Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. Ar-Rahman allama al-Quran. सो कैसे हैं आप सब लोग। आज एक नए टॉपिक हमेशा की तरह टॉपिक शुरू करने से पहले एक अच्छी बात। परफेक्शन इज़ नॉट अटेनेबल बट इफ़ वी चेज परफेक्शन वी कैन कैच एक्सीलेंस। तो कोशिश करते रहें डे इन एंड डे आउट एंड इंशाल्लाह यू विल अचीव इट। सो आज जिस थ्योरी टॉपिक के ऊपर बात करने लगा हूँ दैट इज़ ए बीटा लाइपोप्रोटीनेमिया। मैंने अल्फ़ाबेटिकल ऑर्डर्स में टॉपिक्स को एक्सप्लेन करना शुरू किया हुआ है। So something about the introduction. Abetalipoprotenemia is also called Basen-Konzweig syndrome. It's a rare autosomal recessive disorder. Remember, the inheritance is autosomal recessive. It's due to mutation in the MTTP gene, which results in defective synthesis and secretion of apolipoprotein B containing lipoproteins. And this leads to impaired fat absorption and transport. The patient can present you with the symptoms in infancy and childhood with the fat malabsorption symptoms such as steatorrhea, diarrhea, abdominal distension, and the child can present with a failure to thrive and growth retardation. Or the child can present with the neurological symptoms such as progressive ataxia, child will not be able to walk properly, there will be peripheral neuropathy due to vitamin E deficiency and muscle weakness. So the parents can come to you that their child is not walking and it can come with the ophthalmological symptoms such as the night blindness, which is a very early sign. So the child can present to you that they cannot see at night, and there will be visual disturbances due to retinitis pigmentosa. And there can be you can find the hematological symptoms like fatigue and pallor acanthocytosis and anemia. History, there will be the family history of consanguinity because it is also autosomal recessive. Then finding growth retardation, you will have in stunted growth and underweight, so height and weight will be below centiles. So neurological, there will be reduced deep tendon reflexes, and there will be loss of proprioception and vibration sense, and there will be ataxia gait, so you will check the gait. In eyes, retinitis pigmentosa, you have to do the fundoscopic examination, and there will be visual field loss. And when you do the lab test, you will see in the peripheral blood smear the acanthocytes, they are the spur and then the skin will be dry, scaly skin due to the fat soluble vitamin deficiencies. So what differences you can consider? You can consider fat malabsorption disorders such as the cystic fibrosis, celiac disease, chronic pancreatitis, and the neurological conditions such as Friedreich's ataxia, vitamin E deficiency can be considered, and hematological disorders, hereditary spherocytosis or other hemolytic anemias. So how to investigate? So first you have to do the blood test such as the lipid profile, which shows extremely low or absent LDL and VLDL levels. It will be very low. The total cholesterol will be low, and in peripheral smears you can see acanthocytes, they are spiky red blood cells. And fat soluble vitamin levels show that there will be decreased levels of vitamin A, D, E, and K. Stool analysis will show fat globules or increased fecal fat steatorrhea. Genetic testing is the confirmatory gold standard which confirms MTT gene mutation. So the imaging and electrophysiology, you fundoscopy, you can see the retinitis pigmentosa and nerve conduction studies evidence of neuropathy. The treatment, first of all, is the dietary management. You have to start the child on a low fat diet to reduce fat malabsorption symptoms and the supplementation with medium chain triglycerides as they are absorbed directly. And the vitamin supplementation, you have to give the high dose of fat soluble vitamins A, D, E, and K to prevent complications. Vitamin E supplementation is crucial to mitigate neurological symptoms. Then supportive care, neurological and ophthalmological evaluations, physiotherapy for ataxia and muscle weakness, and the child needs long-term regular follow-up for growth, vision, and neurological functions. I thank you all for your listening, and this is a short review of the topic of A beta lipoproteinemia, and I think this will be enough for your exam if you memorize or listen to it carefully. I wish Allah may be our helper, guide, and protector. I will be looking for your feedback. Allah Hafiz.